Good afternoon, media friends. I extend my sincere gratitude to the Arunachal Press Club for giving us this opportunity to disseminate the informations of a very important institutions that has been established by the government of India and extended to Arunachal Pradesh as well. Today, we come as a Arunachal Pradesh Allied and Healthcare Council. To my right is the Chairperson of the Arunachal Pradesh Allied and Healthcare Council, Dr. Som Sankar Mukherjee. To my extreme right is Ms. Tumpi Siram. She is the Registrar. And I am Dr. Nabam Peter. I am a health research scientist and also given the additional charge as the Secretary of this Allied and Healthcare Council. So today's this press briefing is conducted post our first meeting of the Arunachal Pradesh Allied and Healthcare Council, meeting that was held yesterday. So when we come to allied healthcare professionals, the healthcare professionals, when we broadly say, it includes the scientists, the therapists, or other professionals who studies, advises, researches, supervises, or provides preventive, curative, rehabilitative, therapeutic, or promotional health services, and who has obtained any qualification of degree under the Act, the duration of which shall not be less than 3,600 hours spread over a period of 3 to 6 years into a specified semesters or terms. Now, when we come to allied and health professionals, this includes associates, the technicians or the technologists who is trained to perform any technical, practical task to support diagnosis and treatment of illness, disease, injury or impairment, and to support the implementation of any healthcare treatment and referral plan recommended by a medical, nursing or any other healthcare professional, and who has obtained any qualification of diploma or degree under the National Commission for Allied and Healthcare Professionals Act 2021, the duration of which again is reiterated, should be between 3 to 6 years, divided into various semesters. Now, to regulate or streamline these professionals, the Government of India enacted and passed the National Commission for Allied and Healthcare Professionals in 2021. It was passed through an Act of Parliament and gazetted, notified in the Gazette of India on March 28, 2021. And it came to effect on 25th May 2021. The broad scope of this act is to provide for the regulation and maintenance of standards of education and services by allied and healthcare professionals, assessments of institutions that provides education in allied and healthcare professionals, maintain a central register or a state register for all the allied and healthcare professionals, and to create a system to improve the access, research and development and adaptation of latest scientific advancement and connected matters. National Commission for Allied and Healthcare Professional covers 10 broad categories of professionals, which has 57 allied and healthcare professionals in this. So this commission covers 10 broad categories, which are: first is medical, laboratory and life sciences. Second category is trauma, burn care and surgical, as well as anesthesia-related technology, physiotherapy professionals, nutritional science professionals, occupational therapy professional, ophthalmic science professionals, community care, behavioral sciences and other professionals, medical radiology, imaging and therapeutic technology professionals, medical technologists and physician associates, and health information management and health informatics professionals. So these are the 10 broad categories of professionals which will be covered by the National Commission for Allied and Healthcare Professionals. Taking the Act into consideration, under the Arunachal Pradesh Allied and Healthcare Council was notified in September 2021, and council members were notified in January 2025. That means this year we have notified, the council consists of 20 members coming from various professionals, allied professionals, that we have categorized, and the Council Secretariat is established currently under we have been issued office space generously by the authorities of Administrative Training Institute, Naharlagan. But we are functioning from the Directorate of Medical Education, Training and Research now. The Secretary of the Council was appointed on 1st November 2024, along with Registrar, and the Chairperson of the Council, Dr. Som Sankar Mukherjee, joined on 1st February 2025. Now, after the passing of this Act and after the Commission was established, the National Commission for Allied and Healthcare Professionals has issued direction to all states, union territories regarding the transitory period in granting permission to the institutes for opening new allied and healthcare courses. So the importance of today's briefing is that all the stakeholders, including the educational institutions, the parents and the students, they should know which are and what are the acts that are regulating the professionals they are interested in. If any students or if any parents wants to admit or wants to undergo any course in allied and healthcare professionals, first of all, they should know what are the allied and healthcare professionals. They should know which are the institutions that are recognized to give these courses and what are the standards. So they can browse through the councils or council doesn't have the website yet, but the commission has a website wherein all the acts and all the curriculums are issued. Now, as per the direction of the commission, they have allowed only the proposal for granting permission of admission in the next academic year for approved existing courses only. They have not allowed till the regulations are placed for any proposals in opening of a new allied and healthcare institutions with specified courses and intake capacity. They haven't allowed proposals for intake capacity of existing courses in allied and healthcare professional institutes, or they haven't allowed any proposal for additional courses from the existing allied and healthcare professionals. So, Arunachal didn't have any regulatory body regarding allied and healthcare professionals till now. So, with the establishment of Arunachal Pradesh Allied and Healthcare Council, we as a council will be overseeing the directions of the National Commission, and we will be implementing the directions that are being issued to the states. Now, the Commission, they have issued curriculums for there. Of course, we have 10 broad categories and 57 professionals, but they have currently issued curriculum for anesthesia and operation theatre technology, applied psychology and behavioral health, dialysis therapy technology and dialysis therapy, health information management, medical radiology and imaging technology, nutrition and dietetics, optometry, physician associates, physiotherapy and radiotherapy technology. The Commission has instructed that all the institutions imparting education in these professions may adapt these curriculums from academic session 2020-25 and 26. However, these curriculums are to be mandatorily implemented from the academic session 26-27 onwards. Now, after this Allied and Healthcare Professionals Commission was notified, they have also directed the discontinuation of the use of the term paramedical. Previously, we used to call the other allied and healthcare professionals as paramedical professionals. But via its circulation dated 1st July 2025, the National Commission for Allied and Healthcare Professionals has conveyed that all the state governments, union territories, and relevant universities, institutions are recommended to discontinue the use of term paramedical in all official correspondence, titles, in recruitment rules or notifications, educational materials, or any other government-related documents or portals. The term allied and healthcare professionals, as defined and as stated earlier, should be used for all forms of usage, including verbal, written, or electronic. So, in Arunachal, we have around 7 private universities and central university, but of this, only 3 private institutions or private universities are extending allied and healthcare professionals education. We had our first council meeting yesterday, during which we deliberated on many important issues, of which some of the important issues were, formation of autonomous regulatory boards. Under this council, we need to have boards. So the boards for undergraduate and allied and healthcare educational boards, then postgraduate allied and healthcare education boards, allied and health professional assessment and rating board, then allied and healthcare professional ethics and registration board. We also had deliberation on having our own register or registration system in the council for all allied and health professionals in the states. We also had a deliberation on permissions for establishing new allied and healthcare institutions in the states. We also spoke about how to operationalize our council through seeking funds from the central as well as from the state government. So, through this press briefing, I want to address all the stakeholders. Stakeholders are the government, the policy maker in the government, the educational institutions in the states, which can be the central or government institutions, as well as the private institutions, and to the parents and to the students who are or who will be interested in considering their career in the allied and healthcare professionals. Thank you very much. Now, I'll request our chairman, Arunachal Pradesh Allied and Healthcare Council, to address the press.
Okay, thank you, Dr. Peter. Already, Dr. Peter ने हर चीज़ को डिटेलली हर चीज़ को बता दिया गया कि हम लोग का जो काउंसिल है ऑफ अरुणाचल प्रदेश अलाइड एंड हेल्थ केयर काउंसिल के बारे में। फर्दर अगर आप लोगों को कोई कुछ अगर डाउट होता है या कोई कुछ आगे जानकारी चाहिए, राइट टू एवरीवन जो इंस्टीट्यूशन चला रहे हैं या जो स्टूडेंट्स हैं जो अपना कैरियर एलाइड हेल्थ केयर के देखना चाहते हैं, या जो पेरेंट्स जो एलाइड हेल्थ केयर के बारे में थोड़ा समझना चाहते हैं, इवन द स्कूल्स, कॉलेजेस या जो भी हायर टेक्निकल स्कूल्स हैं जो इसके बारे में और ज़्यादा डिटेल्स जानना चाहते हैं कि एग्जैक्टली ये एलाइड हेल्थ साइंस कोर्सेज है क्या, इसके स्कोप्स क्या है, इसका फ्यूचर क्या है, या ये किस किस एरियाज़ में हम लोग ज़्यादा एक्टिवली काम करते हैं, तो इसके बारे में आप ज़रूर आप निसंकोच ज़रूर आप अपना हमारे ऑफिस में आइए और ऑब्वियसली जो डिटेल्स आप हमसे ले पाएंगे पूर्ण रूप से आप विश्वास कर सकते हैं कि ये भी एक अच्छा प्रोफेशन है और प्रोफेशनल कोर्सेज जो हम लोग चला रहे हैं और इसके कैरियर्स अभी नहीं बढ़ इन फ्यूचर में भी काफ़ी हद तक एज इक्वल एज जो अदर जो प्रोफेशनल्स होते हैं उनके हिसाब से हम लोग भी अपना रेपुटेशन बना सकेंगे। राइट, थैंक यू।